So I think it's really important to manage your expectations that the injection is not going to be the cure-all. It truly is just a Band-Aid fix and should not be the only form of treatment used to try to help your hip pain. Hey guys, what's up? Welcome back to Unchoreographed. I'm your host, Dr. Jenna Lower, and today we are going to be talking all about hip injections. This is a question that I get asked all the time from my clients who maybe have had an injection. They're wondering if they should have an injection. So if you are in that space right now and you're somebody who's maybe had the injection and it didn't work, or it only worked for a short period of time, or you're just left wondering if it even is the right next step for you, this episode is going to be for you. We're going to talk a bit about what injections even are, what they do in your body, when they are helpful and when they are not so helpful, and hopefully help you understand that they are not going to be the end-all be-all fix to your hip pain, but can be a really effective tool if used properly. And if they don't work, that's okay too. It does not mean that your hip is not fixable. It just means that it wasn't the right plan for you. So let's start off just diving right into it. Let's talk about what injections sort of do. Now, there are different types of injections. So there are things, there's cortisone, there's PRP injections, there's lidocaine injections. So there are some different types. I'm going to be focusing today's episode on cortisone injections because that tends to be the most common one that people ask me about, or the most common one that people will have done. So that's sort of what we are going to focus in on. So injections are going to change what you feel in the joint. Okay. They are absolutely going to help reduce inflammation. They're going to help calm down any irritated tissue. They are going to temporarily change sort of the sensitivity that your body has, to the pain in the joint. So all of that is true, but what they don't do is they're not changing capacity. They're not making permanent changes. They really are just a Band-Aid fix for what's happening in the hip. So things like being able to build strength, build more capacity in the joint, build better movement patterns, better load tolerance. Injections are not doing any of that. What they are doing is giving you some short-term pain relief, which can be extremely helpful when used in the right situation. But for the vast majority of people, I think that sometimes they are kind of presented like, oh, we're going to give you an injection and everything's going to be better. And the reality is, well, that's not the truth, right? Like for some people, yes, I see kind of both sides of it, where I have people that get injections and they do work really well when used in conjunction with some physical therapy and with a good plan in place. But I also see a large percentage of people who come to me because they had injections, sort of being promised that it was going to solve the problem. And maybe they've had 2 or 3 injections at this point, and they're still having the same amount of pain, or potentially even more pain than when they started because so much time has passed. So I think it's really important to manage your expectations that the injection is not going to be the cure-all. It truly is just a Band-Aid fix and should not be the only form of treatment used to try to help your hip pain. So very often, like I mentioned, people will get the injection and it'll be sort of a short-term pain relief. It may take a couple days to kick in, but when it does kick in, or if it does kick in, people will notice, again, the inflammation seems to come down, their ability to handle the discomfort in the joint is much less, so they're able to go back to doing maybe things that they couldn't do before. Maybe sleeping is no longer painful. Maybe taking a long walk or going out play with your kids is not as uncomfortable as it was before. So all of that is great. It definitely will help calm those things down. But if that doesn't happen, it doesn't mean that there's nothing that can be done for your joint. What it really just tells us is, well, the injection or the pain, I guess the pain that you were feeling wasn't actually a problem within the joint or within the muscle, like wherever they put the injection. Maybe that's just not where the problem was. So even though these are positive things that can happen from the injection, just because those don't happen, it doesn't mean that your hip is hopeless. It just means that it didn't actually address the problem that was in your hip. Because as I mentioned before, injections do not address load tolerance. They do not address the strength, the stability, the movement patterns, the nervous system. There are so many other things that go into hip pain that an injection just cannot address for you. So this is often why people have them done and get little to no change, or very temporary changes that if you don't have another plan in place kind of going simultaneously, so some good physical therapy, an exercise program, a progressive strength training program, while you have the injection done, if you don't have these other things in place, then they really are very much a Band-Aid, and they're not going to give you any sort of lasting change. The thing that I always like to remind people is, even if you get some pain relief from this, it really is just because you had medicine put there. Your capacity did not change in any way. There was no lasting change that happened in that joint. And again, symptoms are very likely to return unless the capacity is changed or more resilience is built in your hip. Injections cannot do that piece. That is the piece that you have to work on while the injection is taking place, or throughout the time frame afterwards, after you've had the injection. I think a lot of people just automatically jump to, my injection didn't work, it failed, this is hopeless, my hip is doomed, I have to have surgery. So many times that is the jump that people make, that I hear. I had a bunch of injections, no change, surgery is my only option. Again, I'm here to tell you that is not what that means. Absolutely, it is not what it means. It means that the injection didn't address the problem that is present in your hip. If we can get after the root cause of why you're feeling what you're feeling, that is still ultimately what's going to change your pain. Now, there may still be a situation where you have tried everything. You've done really good physical therapy. You've given strengthening 110% shot. And then maybe surgery might be on the table. But if you haven't done those things, if you haven't tried PT, if you haven't tried a true progressive strength program, movement relearning and retraining, if you haven't done those things, do not automatically assume that injections didn't work, I must have hip surgery. Those two things are not mutually exclusive. So I really want to make sure that you understand that, because I know a lot of you guys listening might be in that situation where you've had the injections and nothing changed. So how do we actually make a lasting change, right? What is a better alternative to just putting the Band-Aid on that joint? Well, the answer probably depends a little bit on who you are and what you've tried, but kind of the blanket statement that I will tell people is, you lacked clear strategy and progression. And that's the piece that we really want to focus on. And this could be whether you've had an injection or not. I see plenty of people who come to me after they've had an injection. Certainly my goal is to prevent people from ever needing the injection or wanting the injection, but maybe you've had it, and this still can be really effective for you. So the normal pattern that we see is people are in pain, so they rest, they stop doing the activity that hurt, then they try to start going back to the activity, maybe some stretching, maybe some strength training, random exercises, the pain flares back up, and they immediately stop and have to rest again. So they get caught in this cycle, this loop, back and forth, back and forth. And again, this could be with or without an injection. No matter what's going to break that cycle is having a good strategy and clear progression forward put in place for you. So this can look like strength training, mobility training, but if you guys have been around here for a while, you know that I kind of have a framework that I like to follow with all my clients, no matter what. And we don't jump into the strength and the mobility training right away. My progression that I work through with every single client starts at the very beginning, which is calming down your symptoms. Now, if you've had an injection and the symptoms are already calm, awesome. We still don't want to totally skip over this step though, because what happens when that injection wears off? We still want to make sure that you have a plan in place of what to do if it flares, understand what's going on in your body so that you can calm your symptoms with or without that injection. The next phase is moving into the movement re-education. So this is where we're really diving into, what are your movement patterns? How are you putting stress into that joint? And can we reduce the stresses on that joint? Because remember, the injection is not changing anything mechanical. So you can have the injection, You go right back to moving the way that you were moving that caused the problem in the first place, and now you're in pain. And maybe the injection worked, but as soon as the injection wears off, you will be back in pain if you have not physically changed the capacity of that joint. So we have to make sure, without a doubt, this piece is so crucial to relearn how to move with good patterns. Way too many people jump ahead to strengthen. And that's true, we need that. But without good movement patterns, you are just reinforcing the dysfunction and the problem. So we learn the movement patterns first, then we layer the strength on top of that and the stability work on top of the good patterns. Now we are reinforcing the things we want to reinforce. And again, injection or not, that process has to take place. This is what's changing the capacity for the joint. This is what's changing its resilience. So once the injection wears off, it's already in a better place. And it's sort of taken the place of needing something external or a Band-Aid. Again, best case scenario is you've never even had the injection and you're able to do this process, which makes it so that you never need it. That really is the ultimate goal, is don't have the injection until you've tried these things first. But certainly want to speak to the people that maybe have already had the injection, because I don't want you to feel like there's nothing you can do if you've already had it. So this applies across the board no matter what. There are times where injections do make sense. So I don't want to give the impression that I'm anti-injection, because there have been cases, not a ton, but there have been cases where I've worked with clients and the injection really has been an effective tool in their treatment plan. The majority of time, I'm still going to always lean towards conservative care. I'm not a therapist who pushes injections for people. I think that they should be avoided at all costs, because there's also, a lot of negative side effects. And I work with a lot of younger patients who are often still, which is really scary, 14-year-olds who are recommended, oh, you have a cortisone injection. And I'm like, you're 14. And I tell their parents exactly what I would do for my own child. I would not want my 14-year-old having a cortisone injection, right? I don't have a 14-year-old, but if I did, I would not want my child to have a cortisone injection. They're still changing. They're really adaptable at this point. So I definitely am somebody that leans on the much more conservative side to not have the injections. However, like I said, I've had a fair amount of cases where it really has been the right next step. So how do you know if it's the right next step? I think one thing is, depending on how bad your pain flare-up or inflammation is, no matter what, I'm always going to recommend try going through really good physical therapy, not just like your run-of-the-mill standard traditional PT that's terrible and they put you with an aid and you just like do a couple exercises, while they're staring at their computer. Like, that's not good PT. That is not going to qualify for those, did it work or did it not work? So you want good, high quality physical therapy that's actually really gotten at the root of your problem, and try to give it a shot for 3-4 weeks. And if within 3-4 weeks you're not noticing any changes, then maybe it's worth a trip back to the doctor to explore, could that be a good alternative for you? Because if you are in so much pain that we can't do anything in PT, even the simple stuff like breathing or rock backs or, gentle, safe movement, if even that stuff your body isn't responding to and it's really flaring on you, then chances are we do need something that's going to calm it down. Does it have to be an injection? No, it could be Tylenol or Advil or something like that, right? It doesn't have to be the injection, but potentially the injection could be one piece of the puzzle that could help. The other really good thing that it's helpful is a diagnostic tool. Now, there are diagnostic injections like lidocaine where it will vary. The purpose is temporary, where they'll inject it into the joint to see, does it take away your symptoms? So it kind of helps diagnose where the problem is, which this can be really helpful if you're not sure if the pain is coming from something like your labral tear or not, which often it isn't. So that can kind of serve as a tool. Same thing with cortisone. If it doesn't make the pain go away, then we're like, okay, that's probably not what the problem is. And we probably shouldn't jump in and start having joint resurfacing surgery. But it can be great as a diagnostic tool. This is also really good. So as I mentioned, if you're in a really big pain flare or inflammatory phase in your body and we just can't do anything in PT, what this does is it's going to give you a window to actually, if it works and it calms your symptoms, it's going to give you a window to start strength training. Now, again, notice I say you have to do some strength training or movement retraining, like all that stuff that we talked about, right? You got to go through that framework, the process. But it actually gives you a window of time to do those things so that by the time the injection wears off, as it inevitably will, your body has built up its capacity enough that it doesn't matter that injection wears off, because you have essentially solved the problem or gotten to the root of the problem. So again, it can be helpful in those situations. Never my first choice. I don't think it should be your first choice either. I think too many doctors are really injection happy or surgery happy, even worse. So I wouldn't jump to that as the first thing. Try some legitimately good physical therapy and then see where that leaves you. And then potentially it could be a tool down the road. Although I will tell you, the majority of my clients never end up having them. So with good PT, it is possible to never actually need the injection. How can you interpret the results though? So maybe you are somebody that's had the injection. Like, how can you interpret, well, did this work? Was this worth it? Whatever. If you notice, okay, I had the injection and it significantly reduced my pain. Maybe not long term, but even for, a couple months, couple weeks, there was a significant change. Then usually what we can deduct from that is, okay, a lot of what you were feeling was inflammatory, and it probably was coming from the location that they did the injection in. And again, it calmed the inflammation, allowed us to build some capacity. So if done in the right order and with a good strategy behind it, it effectively should solve the problem. Having, once the injection wears off, it shouldn't still be a problem. But overall, if you notice, okay, it helped, inflammation is down, perfect. Still make sure that you are doing something to address the movement piece and the strength piece, because without that, once it wears off, you're back right where you started. If it helped really briefly, so it was like a temporary change or a very, it felt a little bit better, my pain came down a little bit, it wasn't zero, that tells us that, okay, probably still some irritation in the joint, but there's a huge mechanical piece behind what was happening. And so we have to build the capacity back up. So really, same as before, build that capacity, build the movement patterns, build the strength patterns, to get rid of that remainder of the pain, because it wasn't maybe just inflammation that was causing the problem. If it didn't help at all, chances are that it was very mechanical in nature. The root of the problem is very mechanical in nature. So just taking anti-inflammatories is not going to change anything, because the inflammation maybe is not what the problem is, or the joint, the labral tear, like if they did it in the joint, that's not what's causing the problem, or the muscle that they did it in, that's not the problem. So it may have just not actually addressed the root of what was going on. And most of the time that has a lot to do with the functional movement patterns. And no injection is ever going to address that. So again, I say this because if you are somebody that's had an injection and it's failed, I want you to know that there's still hope. It just didn't address what it was supposed to address, or what potentially we thought the problem was. In all three scenarios, you still need the same thing. You still need appropriate progression, a clear strategy moving forward. So that really does not change across the board. So just to kind of summarize everything that we've talked about, injections should not be the first line of defense. Can they be helpful in certain situations? Yes. Should they be the thing that's used first or with the expectation that's going to solve the problem? No, absolutely not. What's ultimately going to solve the hip pain problem is getting at the root of why it's happening in the first place, which very likely is teaching the joint how to handle load, build its capacity, and build its resilience back up. And that comes through good movement patterns, that comes through a good strength program, a stability program, and making sure that you're using those patterns for day-to-day functional movement so that it's not consistently creating inflammation and causing a problem in the joint. So while they can be really helpful, while injections can be super helpful to quiet the pain down and change the symptoms a bit, they are not teaching your body ultimately how to handle life again. They're not teaching it how to handle life stresses. And that's the piece that whether you have the injection or don't have the injection, you have to get at. Teach your body how to handle life again. If you do that, you will be golden every single time. So if you're out there and you're feeling stuck, maybe you had the injection, it didn't help the way that you thought it would, it does not mean that you're out of options. It just means that you need a better strategy moving forward. And if you're somebody who is wondering, should I have this injection or should I not have this injection, I would strongly encourage you to find somebody who can help give you that strategy and progression moving forward before you jump to the injection, just to make sure that you really have exhausted all the options before you go to that. So I hope that this was helpful for you guys. If you're ever wondering, well, what the heck, how do I come up with a strategy? What is the progression? Like, I don't even know what this looks like. Send me an email. I will link it in the show notes below. Send me an email. Let's talk a little bit more about your specific situation and see if there's a way that I can help you through that and give you some recommendations. So thank you guys so much for being here, and I look forward to seeing you back next week on Unchoreographed.